City Board of Health meeting. We'll start with a roll call. Thanks for everybody coming. I thank the school, Randy, for offering this space again. A big help. We did hire a new deputy clerk of the court at the courthouse here the other day, so in the event there's a meeting in the future, which there probably will be, we'll be up at the courtroom. Her name is Cheryl Pierce, if anybody knows, but anyway, she's hired on. She did help at the museum. Once she understands all the techie stuff in the courtroom, it'll be good, because I lose technicability of degree. But anyway, we'll start with roll call.
Tom,
yes,
do you
Randy?
mind if I just say a couple quick things?
You bet. Randy.
Number one, we should have a mask on. We ask all adults, unless you're talking or physically distant, have your mask on. Number two, when you guys came in, to your right are some restrooms, so if you need the restroom, I would just ask, don't go out in the hall when all the kids are between classes, if you don't mind. Number three, please talk up, because the acoustics aren't great in here, so Chad just informed me that the louder you talk, the better.
Okay.
And that's it.
Okay. And another thing, that's right, this meeting is 10 o'clock to about 11:45. We've been told. You know, I told Randy we're in his house, and when the kids are all in the hallway, we should finish up at about 11:45, and we'll get through the hallways and be out of the hallways so they can, when they're dismissed at noon. And then what I'll do is I'll start with probably move into just a short public health update, a short COVID vaccination rate, and then we'll move right into the Governor Gianforte mandate. And if you can't hear me, raise your hand a little higher or something like that. Okay, we'll move into that, and that discussion specifically will start with the board, back and forth, and then possibly we'll come to a motion on it, and then just prior to that motion, I'll ask for comment from the public. So, anyway, we'll do our roll call, and Cindy is ahead of me. We do have all the board members here, correct?
That's correct.
Okay, and then the technical advisors, Tom Wagonette.
Russ isn't here, is he?
Where's Russ?
He's on Zoom. Okay.
Oh, Russ is on Zoom, yeah. Go ahead, do roll call with the technical advisor.
Okay, well, I'm going to start from the beginning. Megan Evans. Here. Charlotte Quist. Here. Nicole Hazelbaker. Here. Mike Lacken.
Here.
Rush Schwant.
He's on there. Rush Schwant? Thumbs up.
Okay. Dina Young. Here. And welcome aboard, Dina. Thank you. And Tom Rice.
Here.
Sue Hansen. Here. Tom Leggett. I don't know if he's on there or not.
We'll wait.
Okay.
He could have got tied up. He might come in a little later.
That's fine. Marie Holt. Here. Lady Jones.
No.
Carol Kennedy.
Again, she might come in later.
Okay. Ben Abbey. Kim Martinell. I think she's on there.
Yeah.
Okay. And Aaron Montgomery. All right.
Okay. And one thing I'll comment on, Carla Weidinger was the representative from the town of Lima. She moved out to Oregon or to Washington. Our new board member is Dina Young, and she's from Lima. And we'll introduce her today and welcome her to the board. Okay, with that said, short public health update. Go ahead.
Okay, we have six active cases. Can you guys hear me?
Take it off.
You're gonna have to
We have 6 active cases. Most of them, well, all of them came through the weekend. That leaves us with 852 total cases in Beaverhead County. The long-term care facilities have all been given their second COVID shots, so they're all fully vaccinated. Our COVID clinics have been very successful. We have done 3 so far. We'll start our second shot COVID clinics next Friday, not this Friday, we took a break. We have received 200 doses this week. Since we're not having clinics, we're going to allocate those to doing COVID clinics at Lima on Tuesday at 1 o'clock at the Lima School Gym. And we're working on trying to do them in Wisdom on Wednesday at 1 o'clock. We're trying to find a place that's big enough to accommodate the social distancing and the monitoring after the shot. So we're working on those. It's kind of a tight frame, but I believe we can get the appointments done. It won't be a walk-in, it'll be by appointment. So we're working on that. The next clinic, as I said, for this area, well, it's for the whole county, but it's in Dillon. On the 26th, we will have 450 appointment slots at that one because we are giving our second doses, and plus we will get another 200 doses for first shots. Hopefully I'm not confusing everybody. So we have some other second doses that we need to catch up on. So we're anticipating about 450 people at that clinic. It should go quite smoothly. They've been all going really, really well with all the help with the volunteers and the college. And I think we can easily accommodate 450 people. So anyway, I think that's it. Maybe unless you have anything else.
I just think we haven't had any adverse reactions so far, so that's been a good thing to see.
Okay. That covers the COVID-19 vaccination update and the public health update. Now we'll move in with the board, the discussion and action concerning the latest Governor Gianforte directive to rescind the mask mandate. And I'll open up that for discussion. I myself have looked it over, and I want to remind the people, and the word mandate, Beaverhead, you saw on the TV there was numerous towns that reinstated the mandate, but they too have ordinances that give the mandate teeth to enforce, where a lot of areas in the county, in the state, including us, don't have ordinance to back a mandate in that effect. So, with that said, I think I've got some board members that have expressed an idea of how to handle it from here, and I would leave that up to some discussion. Charlotte is the vice chair. I would ask her to read out a possible motion that could be on the floor for discussion. I know Sheriff Paul's been wanting to hear that too in regards to enforcement. If there is, I have Jed Fitch, the county attorney, here tonight too, or today too. So could you hand that, Charlotte? Might have talk loud.
Okay. And I have, in case anyone hasn't read it, I have Gianforte's most recent directive, a copy of it. But whereas on February 12th, 2021, current Governor Greg Gianforte issued a new directive, Executive Order 2-2021, that rescinds all former orders, Governor Bullock's orders and Gianforte's previous directive, regarding emergency measures to slow the COVID virus pandemic in Montana. Specifically, and I focus on this just because this is what so many people seem to be focused on. Specifically, with regard to masking, Gianforte states, and I quote, "Individual responsibility remains the best tool to combat the spread of COVID. Montanans are encouraged to wear masks and should follow best industry practices adopted by any business they visit to slow the spread of the virus." I want to point out that he didn't specifically say masks were not required. He says that he recommends or he encourages Montanans to wear masks. And that's a quote from the directive. So, whereas, although the counties of Gallatin, Silver Bow, Madison, Park, Powell, Lewis and Clark, Missoula, Bighorn, and the city of Whitefish have implemented their own mask mandate, Beaverhead County has no ordinances in place that would allow enforcement of any such mandates. And that's by virtue of conversations with Sheriff Kraft and Jed Fitch. Therefore, I make a motion that Beaverhead County respect the current governor's order with regard to COVID-related recommendations. Specifically, while mandatory masking is not required, we, as Beaverhead Forte did, we encourage community members to continue to mask and use social distancing guidelines while in public gatherings. And I make that in the form of a motion.
Thank you. And we'll have some discussion among the board. And if Paul, if you have anything, Sheriff Kraft have anything, or County Attorney Jed Fitch, that's fine. And what I wanted to point out too, inside that, my own feelings is it's a personal responsibility, or it's personal choice, back for each and every one of us. That includes businessmen, in my opinion too, the school district. I received some phone calls from school districts in the rural part of Montana, or in Beaverhead County, let's put it that way. And they're all different, which is understandable. Some have 14 kids, 8 kids, 9 kids, 20 kids, that type of thing, where there's a lot in the Dillon area. So managing it is their responsibility. They have good like you look around here, they got very good administrators, very good staff, and they also have a school board. Each one of those districts has the same thing. So I think that message that he sent out reflects the responsibility of those to operate as an entity in themselves. You know, from now on out, where there's no mandate in place, they too can take over their own government or rules for operating that district and operate it as they see fit, which I trust each and all of them, their elected officials, to run that school district.
And that's basically what the mandate says,
Exactly.
or that Jim Forte's recent order says that, in fact, if I can read further, therefore businesses should make reasonable efforts to develop and implement appropriate policies based on industry best practices during this emergency. Where no such industry practices exist, such policies should be developed and implemented in accordance with federal, state, local regulations and guidance regarding masking, distancing, temperature checks, and so forth. So, you know, again, I guess I reiterate that he doesn't say that any of these measures are not to be implemented. He merely throws the responsibility back on businesses, the communities, and most importantly, individuals.
True. And then go ahead, Mayor Mike.
Why don't we just make a motion to say we'll follow the governor's verdict, or order, or whatever you want to call it. And I know you thought that there's a lot of other stuff in there besides just mask in the order. And I would say just make a motion to follow the governor's order, February 12th, 2021.
Okay.
And then we can discuss what that means.
Okay, Mike's put that out. Is there any?
I second that.
Okay. Is there any?
The first motion wasn't seconded, so now the motion was very much seconded. So that's
The first motion was seconded by Mr. Swan.
Oh, the first motion was seconded by
Oh, by Russ?
Russ Swan.
Oh, good,
On the
okay.
stage.
I didn't hear that. You have two motions.
Well, I move to amend.
You moved to amend?
Yeah.
Okay. There's discussion on the amendment. Do that.
What, you better read what it said. Because it basically says the same thing.
Yeah, it does say the same thing.
The last people.
You know, that points out too, and Charlotte said it well, that you have a business and you choose to require masks to come into the business. That's the businessman's choice, business person's choice. And then in that business, for instance, a restaurant, if you'd like your employees, checkers, waitresses, whatever, to wear a mask, that's again the business person's choice, and that type of thing. You know, it's.
And by the same token, I think I feel compelled to point out that if the business chooses not to enforce a mask mandate, then those of us that prefer to wear masks have a choice not to do business with the business. And so it goes both ways.
Very much so. Yes, Michael.
I'll withdraw my motion. I can hold that, as long as we understand what respect means.
Well,
I mean, respect means different things, and pretty much we have to follow. And respect doesn't mean we follow anybody. you kind of agree with it, kind of how you respect, but I can live with that.
Okay.
The thing though is, I'm not sure if the businesses can turn somebody away for not wearing a mask. Because the way I understand it, we don't have a rule that says that you can't enforce no shirt, no shoes, no service. That's been removed.
I refer that question to the sheriff, I may, or the county attorney.
Business, an individual business is just that. He has the opportunity and he has the right to run his business the way he sees fit. If he wants a mask mandate in place, he can ask those individuals that will want to wear a mask to please leave. That's his prerogative. We can't mandate what he does in that business, I don't believe, because we have nothing that has teeth in it.
Well, I understand it when what's been stated is no shirt, no shoes, no service. I was supposedly put up to limit people for health issues. Well, the Supreme Court threw that out of the United States. So you don't, the business, because it's a public business open to people, you're kind of restricting, saying since you're not doing that, you're thrown out. You can't stay. And that could be a 1983 class or suit saying you've taken away, you discriminated against me, you've taken away one of my rights.
I don't believe that's the case. I'm not a 1983 expert. I don't think anybody's a 1983 expert, but
I'm not either. I'm not saying I am. I'm not saying I'm a lawyer either. So.
Given the path that the law has taken in the past, if you don't conform to their requirements, shall we say, you can be asked to leave. Once you are basically trespassed from the business, then you can be arrested for trespassing because the individual doesn't want you to be there. A mask is no different.
Okay. County attorney agree with that position?
My duty here is to advise the board, and now you're asking me to make advice to local businesses, and I think that's a dangerous track for the board and for me. So I guess I'm going to caveat my answer in that this answer is my advice to the board what to do. The businesses have to make their own decisions. I think I agree with Sheriff Kraft's rendition that a business can, you see the sign, right to refuse service to anyone. That's been tested on several issues in the Supreme Court, but you're talking about, for example, bakeries and cakes and all kinds of other social issues we don't need to get into today. But businesses have rights about who they can, when they're open, when they're closed, who they serve, what their requirements are when you're in the business. You don't have the right to go onto the shop floor in the mechanic shop, for example, just because your car's there. They can close that off for the safety of, they can make all kinds of decisions like that. So I would suggest that businesses make their own decisions in light of this. I think the board can make what I think the motion as it stands out before the board from Ms. Quest is that I think the word is respect, but we honor and follow the governor's latest directive, which is a recommendation to wear masks and follow social distancing guidelines, and leave that next decision to the businesses.
Yeah.
I know that's a lawyer's answer, but that's what I am. So there you go.
Thanks.
Nowhere in the order do I see anywhere that says there's a must. It's all should.
I didn't hear you. Sorry, Mayor.
Nowhere in the order do I see anywhere the word must or shall. Is that correct?
In my reading of the governor's latest directive is Governor June 14th is that yes, it's a should, suggest, and recommend.
Suggest, recommend.
Which I think comports with what this board has done since the outset of this situation, has made recommendations. I think they should continue in those recommendations.
And I agree with it.
And I would agree with that too. If you will, I think Jed touched on it just a little bit there, is respect. We've been going through this pandemic for a year now. You've got different ideas, different thoughts, different training. You've looked at different things than I have. Myself personally, I choose to wear a mask. You may not choose to wear a mask. So instead of trying to bully or push somebody into your thought train, why not let them make their own decision? Have respect for what they did. That's the key to this whole thing. if you stop and educate and respect, I think we can get through this. But we can't bully people into their way, into your way of thinking. And that's what I have to say.
Go ahead.
I'd like to read one more quote, and this was from Gianforte, I believe during the press conference when he announced this, and he said, and again, this is a quote, "Since we are not out of the woods yet, I will continue to wear a mask and encourage all Montanans to do the same to protect themselves, their friends, their loved ones, and their neighbors."
Thank you.
You bet. Thank you. Thanks, Jen.
Are we in the discussion phase yet, or?
We're discussing the,
Okay.
now, one thing I was going to point out too, I've been up to the legislature, you know, back in there, and the governor does wear a mask, and he's very friendly, knows everybody. You know, he said, I as the leader want to protect myself so I don't get sick and miss 10 days, 2 weeks, 3 weeks of the session. So he's setting an example by that, as wants to be a leader that's present there all the time. But he'll, you know, take you to the side, pull a mask so he's heard. But then when he goes into the tight places, he wears it then, which is fine. Sue, go ahead.
So on the public health perspective of this, we are still worried. We aren't out of the woods yet. As we know, we've got several variants that are circulating rapidly circulating in our country, and Montana is not a bubble. We will get those variants. The new California one is looking to be more deadly. The other ones are more contagious, but not necessarily more deadly. So we aren't out of the woods yet. I know our cases are down, and I hope they stay down. But only 5% of our population in Beaverhead County, as well as in the state of Montana, has been fully vaccinated. That is not enough to get us to the point where we can say, you know, hey, we don't need to wear masks, we don't need to do anything. I mean, herd immunity, I've heard several different percentages, but anywhere between 70–80% people getting vaccinated is where we need to get at. And we've got a long ways to go. So I guess on the public health side, we just don't, I know everybody's so sick of it, you're probably no more sick of it than I am. We want to just get through this, but please, please, please don't let your guard down. Please, I hope all businesses will take this seriously and put into place their own recommendations. I know that a lot of the employees are wearing masks, but I see a lot of patrons not wearing masks. So I guess it's just a plea from public health to take this seriously. We're not out of the woods. We've got a ways to go yet.
Is there any more comments from the front right here?
I would just have to echo that. I mean, I think in medicine we don't have many things that have a benefit and very little risk. And masks are that. They have a benefit, they have very little risk for the overwhelming majority of the population, and they have a very low cost. So aspirin can't even say that. So I think that that's the one thing we need to remember is something that has very little risk to you and has some benefit is a worthwhile intervention. So I would echo Sue's plea to continue wearing them.
Is there, Mayor? Oh, sorry.
Just want to say, everybody, that I'm not necessarily against masks if somebody wants to wear them. I don't believe in calling anybody sheep or any of that just because they want to wear a mask. Personally, I don't think it helps. I've discussed it so much in here that I don't believe masks work like everybody thinks it is. There's a lot of studies that show opposite that they do help. But I don't have a problem if somebody wants to wear it either. And if they believe it helps, fine. But I don't like a statement, and I'll say this, that we say it will protect you for sure, when I don't believe it does. So now what it is, and this is people I know, they will then believe they're protected by wearing a mask. So then they'll go into a higher risk area and put themselves, and that mask might not help, because I know some people that caught it without even, and they're going, I wore my mask. How did I catch it?
No one's ever said it was 100% there.
We've heard that numerous times, Mike.
But
Who was over here? Dina?
Well, I just wanted to make sure I understand the motion. The motion is to follow the governor's directive to allow local entities to operate as they see fit, or to require the county.
Let me reread.
Thank you.
I make a motion for Beaverhead County to respect the current governor's order with regard to COVID-related recommendations, specifically while mandatory masking is not required under that ordinance. We encourage community members to continue to mask and use social distancing guidelines while in public and at gatherings.
Is that okay? Your question? Go ahead.
Yeah, I guess I'm just confused as to the actual motion. The motion is to, what is the motion?
The motion is to
accomplishing?
adopt this directive. If you read the governor's order, it's Executive Order 2-2021.
Okay. So we're not making a motion to require Beaverhead County wear masks, we're making a motion to
We're
respect the governor's
adopting
directive.
this directive.
Okay.
And in this
Thank you.
directive, with regard to masking, what the governor's directive says, and I read from this, individual responsibility remains Montana's best tool to combat the spread of COVID-19. Montanans are encouraged to wear masks and should follow best industry practices adopted by any business they visit to slow the virus. So then the motion is basically that we adopt and follow this Executive Order 2-2021.
Thank you.
let me,
Okay, just short.
it'll be short. There's a lot more that was said in that order though too, that hasn't really been brought out. First
Yeah,
thing
it's
is-
like this much.
Right, there's quite a bit. One is the phased openings that was put in before, they're all gone. That came from this order. Also, any restrictions on the percentage of how many people can be in, that's all gone.
Well,
The only restriction
quite.
on that, let me finish, please. The only restriction is they have to follow what is practice for businesses. If they can follow safe distancing, they don't have any requirement on how many people can be in there as long as you can safe distance. If you can't safe distance, you can still have a large number of people, you just should be wearing a mask, is what it says. There's a lot of other stuff, they put restrictions now on the health care, like retirement homes, or not rest homes, ones like that. There's some about food, beverage places, restaurants, all that. I believe it actually opened up that now you can have salad bars again, as long as you can practice safe distance. There's a bunch of others. It is a humongous, it's like what, 16?
and it's, yeah.
15 pages.
And this is readily available on the internet. You can go and download it and print it just like you do.
Is there any other comments from the front table, board area? Over there. Okay. Next, before we come to a vote on the motion, I'd like comments from the public, and stand up and talk loud so we can hear. I'm trying to do that up here. So is there any comments from out here? Way in the back.
My name is Michelle Brown. I live in Dillon, and I'm representing my child that is enrolled in the K-8 school here at Dillon. And I would just like everyone to recognize that these school districts, all these individual school districts, many of us have already spent a phenomenal amount of hours with the school boards putting in levels or layers of if this happens, this is what we'll do. So some of these mandates just are a one-size-fits-all approach. It's actually undermining what we're doing. So I just want y'all to know that many places actually go above and beyond and are tighter, and it's just causing this counter confusion. So this one-size-fits-all approach doesn't necessarily work for everybody. And in our case here, after we have spent months after months, and I'm talking school board meetings, folks, that last till midnight, Be thankful you're only here for an hour and a half. Parents showing up month after month to hammer out these layers of what happens if we get 5 cases, what happens if this goes up. And then also the complexity of making sure that we spend our COVID dollars legally. And there may not be COVID dollars to provide masks for every single person. Does that make sense? So now it might even come out of our budget. And we're already down on our budget. We are going into a crisis situation potentially because of the amount of parents that withdrew their kids. And it wasn't necessarily, everybody wasn't afraid of COVID. They were afraid of how these adults were going to react and respond around our children concerning COVID. That respect issue, you know. So I just want you guys to also look and just understand that other people, like you said, these individuals, have really invested a lot of time and put in some really good layers and updated our facilities. Like, we spent so much money on this facility to be hands-free. Walmart didn't do that, but we did that here in Dillon. We've been successful. That's why our numbers are up, because we have shown responsibility. So I hope that we do just continue with your approach. We'll adopt the governor, just like we did the last time, and we'll leave it as our individual responsibility. And we'll let the parents of the Dillon School District work on it too.
Okay.
That's all I have.
Thank you. Yourself?
Yeah, I got a comment or question.
Your name?
Justin Martin.
Okay.
Yeah, comment, a question, and then a comment. I guess my first comment would be, I appreciate you as a board allowing some discussion, but then also, it seemingly sounds like adopting a demand or recommendation by the governor to lay it at the foot of the individual. I really struggle personally with any forced compliance by anybody, because what that does to me is it says, unless you comply, there's penalty. And I don't know where in any sort of forced compliance there's an aspect of love at all. And if we talk about supreme ethic, I think that's the thing that we need to remember, is the love of each other, right? For the benefit of each other. I don't think, as Mr. Mayor said, there is any sort of sheep or whatever. So I really appreciate that, because if we do get into a forced compliance system, you get pushback. We see that in any sort of area where there is forced compliance and pushback. So I just want to say I appreciate that. I think that is a wonderful idea. The question that I have is when it comes to vaccinations, what we've seen with the people who have accepted the vaccination and look forward to the future on when there could be a herd immunity or a case. So here's my question with the vaccination. With what we know currently about the vaccination, it seems like the individuals that get the vaccination is working to protect them from getting sick, but they can still transmit. So the people that are with the vaccination are still asked, out of concern for them and for their fellow men, to still wear masks, do the safe distance, do all those kinds of things. Is there any discussion on, is there an end in sight? Because it seems to me like a herd immunity and a vaccination, it still seems to be we still need to mask, social distance, and all that kind of stuff. So I guess my question to whomever wants to answer it would be, what is that? Is there an end in sight? Or will it always be, because it's a virus, it's never going away, we'll have to live with it? Is there any sort of thought on that?
Dr.
I think we don't know. People could still transmit, but they might not. They might not at all. We just don't have enough data yet. But I'm sure we will get more data. It kind of depends on how the vaccine companies have managed their trials. Mm-hmm. Some of them are doing a little more in-depth look at that, where they're actually testing people randomly to see if they're transmitting or not. Other studies have just tested people who are symptomatic, so we don't know if they're transmitting or not. The CDC this last week just came out with guidance that said that if you've been immunized and you're after at least 2 weeks after your second shot and within 3 months from your second shot, you don't have to quarantine if you're exposed again, if you're asymptomatic. So I think that is a light at the end of the tunnel. That's showing that people who have been vaccinated have enough protection that they can still go out in the community even if they've been exposed to COVID. Kind of frustrating that the CDC only said 3 months, but that's just because that's as far as the data is now. My guess is it'll be longer and longer, and we'll be able to say, I've been vaccinated, I'm okay. I don't know when we'll be able to not wear masks or not. It'll rely on that data.
Right.
If people don't transmit it when they've been immunized, then they can probably not wear a mask, but we can't say that yet, so we're just being extra safe.
Right. I understand, I guess that's what I'm getting at, is that I think it might be dangerous mentally for a lot of people to assume that because we have vaccinations or whatever, that they'll be able to get out of it or whatever. And the reality is for us is it is a virus and there is no date in the future. So, okay, I appreciate that. And I guess the last thing is just maybe something to think about with the idea that if we just wear a mask, nothing bad will happen. Not with the virus. Here's my point. I have a 7th grade son. Plays basketball, plays football, runs around, he's with his buddies, he's everywhere. None of those things that he does require him to wear a mask. He went to school on Monday this week. For the first time this whole year, he did not have to wear one. And I said, hey, bud, how did school go? He said, it was great. I said, how'd it go not wearing a mask? He says, you know, Dad, I felt weird not wearing it. He said, I found myself grabbing right here and wanting to hold it over my face because I was uncomfortable. That is an almost 13-year-old boy who is healthy as can be, mentally worried about himself getting sick. So I guess my point is that there may be something else that we might have to worry about down the line, and we need to, and then I'll go back to my first comment, that I appreciate you leaving it up to the individual so that we don't create this mental battle of am I safe, am I not? So that's just a comment there. So thank you.
Thank you. Yeah, Julie?
One of my concerns,
You're
and
gonna
I
have to
will.
speak up.
Ow.
Talk loud.
I'm sorry. If you guys want me to pass around, I have a doctor's note that says that I really shouldn't wear a mask all the time. And I do wear the mask when I need to. I feel I'm far enough away from people right now. But one of my concerns is, and I've heard this today, people insinuating things about people that are not wearing masks. Now, there are people that can't wear a mask for certain reasons. And so, talking about businesses and that kind of thing. So, I think that the same goes for wearing a mask as not wearing a mask. We need to respect everyone. We need to respect who they are and possibly what their problems might be, and not judge those people because they're not wearing a mask. I will tell you, I personally have a niece. Her mother is very terrified about what's going on. She's 8 years old and she will be getting a feeding tube because she is so traumatized by what's going on that she's not eating. So when Justin is talking about other problems that might be happening. There are other problems that might be happening. And that's something that I think that this board needs to look at. I came here a couple of times before talking about the number of deaths in Beaverhead County. When I have a concern that how far does the monitoring go? You all have all the data on who gets vaccinated. How do we know? How are we tracking that? And I know some people have told me that we're tracking it on our phone. This is an experimental vaccine. I guess, I don't even know if it's a vaccine or whether it really, the definition of it is a vaccine.
It's a vaccine.
Is it a vaccine? Okay. Has the virus been isolated?
You cannot isolate the virus from the vaccine. It's only the mRNA portion of the spike protein.
There's no full virus in the vaccine.
Okay, but has it been isolated? Is this something that...
Isolated from where?
Do we know? Can you take a person with COVID and can you isolate that virus?
I think if a person had been exposed and had an active viremia, it would be possible to isolate that virus and go ahead and grow it in appropriate culture.
Have they done it?
They did that immediately and sequenced it immediately. We don't use viral culture routinely anymore because we have PCR testing, which is so much more superior.
But they had to isolate the virus to obtain the
Okay,
genetic.
we're getting off on a different conversation, but as far as the masks go, I do want you to know that there are unintended consequences in maybe steering children and people into wearing them. And so I do have a concern about that. I also have a concern about if we are tracking people and we are tracking their symptomology and whether, I know I talked to someone regarding if there's anyone tracking the deaths after the vaccine. And that's not something that can be determined by an autopsy, whether someone died from the vaccine, unless they died from anaphylactic shock immediately. So there's no way that that can be determined.
Thanks, Julie. Randy?
My name is Randy Shipman. I'm the superintendent of this district, and since the school's come up quite a bit, I want to just respond real quick. I appreciate Michelle's comments. We have worked extremely hard. To be clear, and we have a lot of parents here, to be clear, it's not parents that make the decision, it is our school board. And our school board are made up of phenomenal individuals, 7 of them, and they have worked extremely hard, as my principals and I have over the last, really since March 16th. A lot with Sue and a lot with Dr. Evans. But our parents are who are the parents of our kids, our clients, and so we appreciate their input and we listen to their input. And we did have a 5-hour meeting, almost entirely over masks. But I guess I'm here to say that I am a professional educator. You guys are the professional medical field. We will do, and we have done, I've worked with Sue closely, I've worked with Gary Haberfield at the high school district closely, and we will do what the medical experts tell us to do or what the governor tells us to do. We have not, and again, I really appreciate Michelle's comments, we're not doing anything here at school. We have unbelievable mitigation strategies in place. Just because we lifted the mask mandate, that is because back on August 11th, our school board made that decision after hearing from a lot of parents, after hearing from the administrators, after hearing from some staff members, after months and months, or at that point about 3 months of constant hours of putting a plan together, with a lot of other folks, staff involved, county health involved, and a lot of folks, we had a great plan. We still have a great plan. It at this point does not include masks because on August 11th at 12:02 a.m. when that meeting ended, it was the next day, as some of you know, August 12th, that the governor changed that policy. And we went with that policy, and we have done that. We've done quite well. And I have no doubt that masks are a part to our success. But I also believe that our mitigation strategies, including our hand washing, our cough and sneezing etiquette that we teach the kids, our cleaning regimen, our cohorts has been huge. Where it's made sense, and I feel bad for wrestlers, but where it's made sense, like in wrestling, we have not had a wrestling season. And that's not good for those kids, but we have had all of our other seasons, Justin referred to some of those, and we've been very successful. We had to close boys basketball down early. We had to close girls basketball down a little bit early because of some issues. But all in all, we have been pretty normal here at school with some other mitigation strategies in effect. We're going to continue those. But I want everybody to know we're getting beat up sometimes on social media and things like that. We're doing exactly what our board has asked us to do. My job is to take the recommendations or the policies that the board adopts, and put them into place, and that's exactly what I'm doing. And if this body or the governor says, who are the experts, the governor's an expert in his own right, but in county health, if this board says that we should wear masks, then we will go back to enforcing that, and we've done quite well. But I really appreciate a lot of the parents that have had a lot of input into our decisions, and I don't know, I have a lot to say, but I think I'll leave it at that. We have done quite well, and I appreciate all of our kids and all of our staff. Our staff members continue to wear the mask, they're most at risk. If you look at the study, even the recent CDC guidelines, there's lots and lots of evidence in there that suggests, once again, as I've said from day one, that 11 and under do not transmit the disease, do not get the disease, so on and so forth, like older kids do. Now, that leaves our middle school, and if you remember, or if you don't know, just so you know, my recommendation was that our middle school students would wear masks, our elementary students would not, and because of the interest of our parents, who are our constituents, the board did not go with my recommendation and went with the recommendation of no mask. That again was changed by the governor. So we're happy to do what the experts ask us to do, even though some of our parents won't like that. I'm also very happy to not have the mask mandate, because I think, Julie, you are 100% right, and I wish not this board, you guys are phenomenal, but I wish people would start looking at the ill effects of our kids, that the masks are having on our kids more and more and more, because we're seeing some horrible, horrible, horrible things. Thank God we have not had something worse in our community happen to this point. But anyways, thank you very much, and thank you again for all that you guys do for our community.
No, thank you, Randy. Kelly's a teacher and speaks in gymnasium. You do really well. So, Shannon.
My name is Shannon Maines. A couple questions. Well, first off, I strongly support that we do not do anything more restrictive than what the governor has, like some of these other counties. So, I mean, I think a lot of people are against that too. So that's just public speaking to the board. My next question is, we're talking about businesses, they can make their own rules. But then I want to touch on what Randy said, schools, the YMCA, things like that. My question is, how do those things relate to this governor's mandate? Okay, so you don't have to wear a mask. What about, and I'll use an example, parents can go, parents can't go to watch a kid's event. Is there anything in the governor's directive about that? And also, if there is or isn't, when I question those things or ask people, why is this such and such, a lot of the response I'll get is, we're just doing it because that's what public health is telling us we have to do. So my question is, does public health, I guess, have teeth in that to be able to say, the school has to wear a mask or we can't wrestle? So I just want to know what kind of power that's.
In the governor's directive, there is a section for schools, and it's a couple sentences long, not very long, but okay. It reads, access to schools is essential to the development and social, mental, and educational needs of school-age children. Schools should make reasonable efforts to follow school guidelines and best practices recommended by the CDC and the Montana Office of Public Education. That's what it says.
Office of Public Education, not the Office of Public Health, Beaverhead County, whatever we have here.
No, it just, now, correct me if I'm wrong, Randy, but the school districts, like any district, is an entity in themselves.
The school district,
yeah,
is that the same as?
Same as the irrigation district, the hospital district, but the YMCA, no. That's an individual business, a 501c3, however that goes, but they aren't a district, but a district is an entity in itself.
And we're a public entity.
Exactly.
That's the difference. And so Shannon, and just so everybody's clear, the governor is, if you will, on the top, and the county health can make recommendations to us, and so wrestling was a recommendation, and we want to use common sense. We thought that made sense. But they can also mandate to us, and so you have the governor here, you have county health here, and then you have the school board. And so absent county health or the governor making a mandate or directive, then the school board has full authority over this district, and that's why we went back to the policy that was, we're not getting rid of masks per se, we're going back to the policy that was adopted on August 11th that the governor has rescinded. So I think Commissioner Rice is correct, Shannon, in that YMCA is a little different because I'm assuming are they public entity?
What?
The big difference for us is we are a public building, a public entity, and therefore we you know, we fall a little bit differently. But let me be clear, our Board of Trustees, from Chairman Peterson and all of our trustees, they're in charge of this district, and they're the ones that set policy for this district for your children. And that's why I kind of said earlier, and I'm teasing some of these parents out here, because they've been very involved. We hear you, and we appreciate your voice and all that stuff, and we get both sides. But ultimately, it is the board, the trustees, the 7 trustees that make the decision. You have voted for them. You are their constituents, and they make the decisions, you know, good or bad. Whether you like it or not, they make those decisions, unless county health or the governor supersede that. So I hope that answered that.
So let me ask a question. Am I correct in understanding what you said? We don't have anything where we can be more restrictive than the governor? Is that Beaverhead County?
There's nothing in the motion that's on the floor that's more restrictive than.
And but you said we have never had an ordinance like that before, right?
No, there's no ordinances. The ordinance is help me, Jen.
What Commissioner Rice is trying to say is that the county, and I believe the city, but in this case it's the county, the way the city-county health board's formed, doesn't have an ordinance in place that will allow the implementation of a mask ordinance per se. That's why it's always effectively been, we've adopted the governor's recommendations and the governor's rulings. This motion before the board, Shannon, is to adopt essentially the existing recommendation of the governor, which would not be more restrictive. Those other ones that were listed by Charlotte are other counties and Whitefish, the city. They are more restrictive than the governor's ordinance. That's those counties' prerogative, just sort of in the way that Mr. Shipman just explained. And so, without that more restrictive thing, Mr. Shipman's exactly right. Then the school can make its decision. It has to do it in a public format like the school board, and we use the YMCA's example, so I'll follow with that. That as a private nonprofit entity has its own board, and they can make their own decisions, just like, and I'll just cite examples, just like Town Pump or the Mini can make their own decisions.
Okay, so that's your opinion.
Yeah, I just wanted to make a distinction, county health, board of health. The board of health is the entity that has the authority to do mandates, directives, whatever, if there was an ordinance in place in Beaverhead County. It is not public health. Yeah, I just wanted to make that clear. The public health office is different than the board of health. But as Randy said, we work very closely and we give our recommendations to it, to all the entities, and as you know. So just so you know, there's a distinction between the two. Thanks.
Thank you. Is there any other comments from George?
Thank you, Tom. George Warner.
Speak up.
Yes. I want everyone to know, including the board, that I support the motion as it's on the floor. I believe you have the authority to do exactly what you're doing, and that I think you've had very good legal advice. Jed and Paul have done a good job researching this, and I think they've given you very good advice. One thing that I think you should know, in my studies on Butte Silver Bow, they haven't had good advice. They have no more authority than you do. Their ordinances, which were codified in 1978, actually gives them the authority to regulate utilities, and no one has questioned them. I recently I sent an email to the Attorney General yesterday. I haven't received a response on that. I think everything that you're looking at right now is appropriate. My concern is with private businesses, and I believe it's still part of the governor's directive. If a person states that they have a physical or a health reason that they cannot wear a mask, it still cannot be questioned. So there is no authority to kick somebody out on the basis of them, if they make that statement that they've got health reasons. They cannot be discriminated against in that aspect. So that's the only question mark that I have in this process we're looking at today. And maybe we can discuss that further.
Thank you, George.
Thank you.
Jeremy, anybody have a comment?
Jeremy Albert, please. I just want to say thank you for everybody coming. It's going to take a community to get through this. If you guys look around the room, not only do we have private citizens, but we have the school district here, UM Western, the mayor, the county attorney, Paul Kraft, Marie Wolf, everybody. This is what's going to get through us together. It's going to be together. We're going to fight as a village, not as individuals. So I wish everybody well.
Yep, thank you, Jeremy. Jed?
Echo slightly Jeremy's comments. We're all sort of interlocking here too. I mean, I have children at this school, and I have kids on the same travel team, and I'm a county attorney, I advise that commissioner. You know, my father just did 15 days on the ventilator and 60 days in an ICU because of COVID. So it's very real to me. But I will tell you that this community has done exceptionally well. I want to thank particularly Sue Hansen for her work, and this board, and Mayor Clacken for his efforts, and Charlotte for her efforts, because all together, I mean, Jared's exactly right. We've got to this place where, you know, we've had trouble with this community, but we're in pretty good shape compared to a lot of places. And that's because of what Justin Harper talked about, love, and the fact that we respect one another. We try to do the very best by this community, and that represents everybody. I think, I'm going to pick on Justin again, talking about, I'm the person that's the enforcement around here sometimes, and when you're going too fast on the interstate, that case comes to my office. So I understand that stick of enforcement, and it's got its place. I don't think it belongs here. I think we do the right thing, so I congratulate this board and this community at large. So I thank all of you. Thanks for listening.
You bet, thank you. With that said, I'll read the motion again so we're all aware. And is there anybody on Zoom have a comment? Thank you, Cindy. Forget where I'm at. Anybody on Zoom have a comment? Seeing none, go ahead, Randy.
One comment kind of from Zoom, just a reminder for Mr. Haverfield. He's unable to unmute or something, but he's right in that, and I failed to say this. The local school board can also set policy that's more restrictive than either county health or the governor. And we've done that somewhat in our policy 1900 series, 1905. So just to be clear, he wanted, good point to make everybody clear, we can set in our district, just as county health can set policy more than the governor that's more restrictive.
Yeah.
Just point of clarification.
Yeah, that's a good point. Thank you very much. Thank you, Greg, too. So, I'll read. Okay.
You just said county health can get more restrictive than the government.
Absolutely.
In theory, they can if they pass the ordinance, if the county passes an ordinance, to enforce, or the board passes an ordinance. So, yes, theoretically, yes, but that's not happening.
Not right. Yeah, that's not the motion.
I agree with Mr. Shipman and what Mr. Haverfield said to Mr. Shipman, that the school boards can take their own actions to make decisions on advice of the CDC, just as the governor director says, to make decisions for that school board. That's what he wants, local decision.
Then, like Randy pointed out, Whitefish, the town of Whitefish was in that, what you speak of. So, yes.
Sarah Herman, I just want to clarify too that I think, again, as far as our personal responsibility, I want to encourage parents and individual citizens to continue to come to these meetings and to hear for themselves what's happening, especially school board meetings and the health board, just because I do think things are adjusting and changing, and if we don't talk to each other and ask questions and feel comfortable saying, hey, what is your comfort level, or what is necessary? I know our kids ride the school bus, and so it's a different school district. The school bus requires masks to be worn when they're riding on the school bus. And so we're also teaching our kids that they have to understand kind of what, the dynamics of this is, and then have them be confident in their choices too. So just continue to talk and continue to ask questions, because I think it is really confusing at times. But if I can be an example, I've blubbered my way through several Board of Health meetings just asking questions, and everyone's always been very receptive and kind and helpful in helping me understand. So thank you guys.
Okay, thank you.
And I just,
go ahead.
one more, I'm listening, I'm a small business here in Dillon, and I'm very, very grateful for the opportunity to discuss personal responsibility with people. And so thank you guys for what you've been doing. And also just a reminder that I think most people are having those conversations, and like someone else said, if we come into them with assumptions about why people make those choices, that's the best way to guarantee you can't have a conversation. And then you don't actually know your local community members, and you're not able to be in relationship. And I think this is proof here that we really love where we live, and we love our local community, and knowing just in a small business, the people who come in, there are really valuable conversations to be had, and I think people have done an impressive job of wanting to educate themselves and understand what's going on. And I think this is a way to reach that keeps going, so thank you guys.
Okay, I'm gonna, like I said, I'll reread this motion so all can hear it, and then we'll vote. Beaverhead County, motion for Beaverhead County to adopt the current governor's order with respect to all COVID-related recommendations. Specifically, while mandatory masking is not required, we encourage community members to continue to mask and use social distancing guidelines while in public and at gatherings. With that said, well, I'm going to do a roll call vote this time so everybody can hear. And I'll start here at the top of the list, I guess. Mayor Claggett. Aye. Vote yes. Megan Evans. Aye. Yes. Russ Swan. Thumbs up. Yes. Nicole Hazelbaker.
Yes.
Yes. Charlotte Quist.
Yes.
Tom Rice. Yes. Oh, excuse me. Danny Young. Yes.
Yes.
Yes or no?
Yes.
Yes. Okay. Thank you. I still apologize for doing that. We are unanimous. Yes, the motion passed. So with that said, I'll move on in the agenda to old business, and that's approval of the February 3rd minutes. Did you all receive those?
Move to approve.
Got a motion to approve the February 3rd minutes. Is there a second? Second. Got a second from Mike Clapper.
Can I say something? Kim Martinell had sent me an email. I had a couple misspelled words. So I'll fix those. Okay.
Okay, I've got a first and a second to approve the February 3rd minutes. All in favor say aye.
Aye.
Aye. Okay. And then public discussion, comments, and subjects under Board of Health jurisdiction, but not on the agenda. Did we overlook something? Hearing none. The next meeting is tentatively scheduled for April 16th, 2021, and it will, I assume, we'll try to get it in the courtroom. We do thank Chad for running our Zoom here and Randy for setting this up, but we've hired a new deputy clerk of the court up there who is learning the technology up there and will help us out next time. But thank you greatly for applying and letting us use the library in this area too.
You're very welcome. We're happy to host.
What time is that next meeting?
We have to check, we'll know what time on that next meeting after I check the court calendar. That we'll set a date. Like it says April 16th. Go ahead.
May I make one last comment?
You bet.
There's so much to say, I forget everything. I'm so
Well,
sorry.
that's fine.
I also want to be clear that we are still highly encouraging. And if you read the paper, unfortunately how the paper got it wrong, I'm not sure, because they took it right off our website. It was word for word. They left the word strongly out. We are still strongly encouraging our kids to wear masks every single day. We have about 20 to 30% that are wearing masks daily. They are not being bullied, to our knowledge. If they are, we deal with that. We highly, and the words are strongly, but if you read the paper, it just says encourage. It's actually strongly in front of that. We strongly encourage our kids to continue to wear masks here at school. And the high school is still wearing masks, and Sarah kind of alluded to that with the buses. So I just wanted to get that out too, sorry.
Okay, thank you.
Can I also make a statement for the university? We will continue with our recommendation from our system office and the board that we will continue to to require, it is a mandatory, mask wearing of all people that step foot on campus. So you're welcome, but you must wear a mask.
Thanks, Nicole.
Tom, can you hear me?
Yes, go ahead.
This is Gary Allen with the high school. I just, thanks for providing me the opportunity. Just want to say just a couple things, just so the county health board understands where we're at. Now that there are no mandates in place, either from the governor's office or from the county board of health, like Randy said, we'll follow those if we have to, we will. But now that there are no mandates in place for us, we have to go back to our board policies regarding all the COVID policies that we have, and that for us is 1905. And just so you know, masks are required at the high school and all buildings still, because we have to follow our policies, and that's the way it was established back in August when we established all those policies. And so I just want to make sure everyone understands, even though there's no mandates, we still have to follow board policy. Our board policy right now says that there's still required to be worn in all school buildings. And so I just want to make that clear for everyone.
Okay. Thanks very much. All right, go ahead, Sue.
Do you want to read what Carol said for the hospital?
Oh,
Will you read it?
I can read it.
Can you read that?
Yeah, somebody read that, what Carol
Their
said.
hospital and healthcare will continue to require masks for entrance into our facilities in order to keep our patients and staff as safe as possible.
Thanks, Carol, for that. That's from Barrett Hospital. Again, Barrett Hospital District too. That's a comment. Go ahead.
I have to agree with that approach also. Beaverhead County Sheriff's Office will continue to mandate masks coming in the front door. If you have stuff that you need, business that you need to take care of, please wear a mask. And the reason that we're doing that is for the inmate population. We have, and I'll knock on wood, gone COVID-free in our jail for over a year now. And I want to continue that. So we're continuing our screening our people coming in, screening our employees as needed, and please wear a mask when you come in for business with the sheriff's office. Thank you.
Okay. Okay.
Linda Marsh would like to say.
Oh, excuse me. Linda Marsh, Superintendent of Schools is on. Go ahead, Linda.
Hi, I would just like to let the health board know that I really do appreciate everything that you're doing and Sue's efforts as well. And that, like Gary said, all the little rural schools are going to be reverting back to their opening plans that they approved in August. And there is a little bit of a mismatch in some of the wording in some that say that we will follow the governor's mandates and the CDC recommendations. So our boards may be meeting at their next meeting to decide if they will continue on with the requirement of masks. So that's kind of where they stand.
Okay. Thanks, Linda. George.
One last thing, I was finished, but there seems to be a number, and I understand the school districts in their individuality and their authorities, but we've got a lot of statements of entities that are saying that they're going to mandate masks. And consider this a FOIA request. I want it disseminated as to where their authority exists. In other words, if the sheriff's department demands it, where is he hanging his hat to have the authority to mandate it? Very well could be out there, but I don't know where it's at. The college as well, they may have the authority to do that, but I don't know where it's at, and I should be able to know where it's at. So it should be disseminated. Next meeting would be fine, but we should know who has the authority and how. Thank you.
To address that, George, our
Yes.
Board of Regents has the authority, and that's what we will hang our hat on.
Okay.
Okay. Next, like I've mentioned, a tentative meeting, April 16th, time to be announced, and for sure that date to be announced after I check the court calendar. Any new business? Seeing none. Need a motion to adjourn. Before we do that, though, I'd like to thank Sheriff Paul, Jeremy Alvarez from the Dillon Police, Judge Fitch, thank you, and Randy, and Greg, and Chad, and all those from the school, and each and every one of you that, I hope I didn't miss anybody, but each and every one of you that took time to come today. Very much so. Thanks.
Thank you guys.
I need a motion to adjourn.
Thank you.
Nicole, second. I've never had that turned down.